I am really excited to have another special guest. Her name is Dr. Lori Dos Santos. She is a licensed clinical psychologist that works primarily with adolescents and young adults. With her naturally warm, calm, easygoing demeanor, and through her dedication to listening carefully and empathetically, she has cultivated an exceptional ability to connect with young people who are struggling with difficult, often complex issues. She takes the time needed to build understanding and trust, then engages each client in a program of treatment that builds on the client's personal strengths and addresses pressing concerns. She encourages, supports, and guides her clients as they acquire insight into their thoughts and behaviors. She makes sure that they acquire practical skills that they can draw upon daily to experience positive change and meaningful transformation in their lives. She has particular expertise in working with young adults who are transitioning to and managing the stresses of college as she provides strategies and techniques that lead to increased autonomy and independence, as well as improved relationships with family, peers, and partners. And of pertinence to our podcast and interest today, she has a particular interest in clients with complex medical and mental health conditions and is pursuing advanced training in addressing the mental health symptoms associated with postural orthostatic tachycardia syndrome, known as POTS, and chronic fatigue syndrome, or CFS, all of which fall under the umbrella of nociplastic pain conditions, with fibromyalgia being one of those as well. And she is the founder of Evolvin Therapy and Consulting and does virtual work with her clients and also has others that work with her. There's more that could be said about all of her experience, but we want to get into knowing her. For those of you who are new to the podcast, I am your host, Dr. Michael Lenz, a pediatrician, internist, clinical lipidologist, and lifestyle medicine physician, and author of the book Conquering Your Fibromyalgia: Real Answers and Real Solutions for Real Pain. Remember that while I am a doctor, I am not your doctor. All of your signs and symptoms should be discussed with your own physician. And now back to this week's episode. So, welcome to the podcast.
Thank you so much for having me.
Awesome. And just to get to know a little bit more about you, what drew you into the world of psychology and then into this specialized area that not a lot of psychologists have a lot of experience with?
Yeah, I always knew that I wanted to work with people. I just wasn't really sure in what capacity. And so initially, when I went to college, I pursued education and I thought maybe I wanted to become a teacher and learn how to teach others. And I got assigned to my first kindergarten classroom to shadow and observe and help out. And I was specifically assigned to a 5-year-old boy who was struggling to learn his colors. And they wanted me to work with him individually to help teach him all about his colors. And I realized very quickly I had no interest in teaching him about his colors. I wanted to hear about his passions, his values, his family life, his hobbies, everything else that he was interested in. So I quickly pivoted to psychology, knowing that was going to be the right avenue for me. And over the course of my career, I've done a lot of different work. I have really gravitated towards complex patients. And so I spent many years in the juvenile justice system and residential treatment, working with adolescents and young adults with criminal histories and just complex mental health needs. And when I started in private practice about 13 years ago, I was working with adolescents and young adults. And I was assigned probably about 8, 9 years ago. I got my first patient who had POTS. And I had no idea what it was and had no idea anything about the condition, but I was incredibly compelled and intrigued by her story, which I think is similar to so many other stories out there. And so I was really taken to how much this condition affected her life, how invalidated she was by everyone around her, teachers, doctors, how long it took to get a diagnosis, and how much loss she had in her life, how much she was struggling with grieving the loss of activities and sports that she used to be involved with and really having to pivot and change the course of her life moving forward. And from that point, I was sold. I was really dedicated to learning as much as I could, understanding as much as I could about the condition and making it my specialty.
Awesome. Thanks for
Yeah.
sharing that. What insights have you learned over this 9 years that you didn't really know. Going back to that first patient and now obviously have with lots of working with lots of people who are struggling with that. What are some things that you learned that are helpful for the patients themselves going through this and their family and loved ones, and actually for other clinicians out there, whether psychologists, therapists, physicians, that are important things that most aren't aware of, and maybe you weren't in the beginning and you've had to learn through.
Yeah. Oh, there's so much. There's so much to delve into. I think first and foremost, and probably the most important out of anything I'm going to say, is how important it is to build a relationship with my clients, to really understand each person as an individual, to develop a sense of trust and belief for what they're describing in terms of the symptoms they're experiencing, the impact on their life, and really appreciating the fact that no one wants to live with this condition, how significant it's been in their life, how interfering it's been in their life. And if they could wave a magic wand and get rid of it in a moment, they would. And so really starting there has become the crux of the work that I do is getting to know each individual client, their story, their strengths, their challenges, their relationships in their life, and just hearing them, believing them, understanding them, empathizing with them, validating them is always my starting point. And I think so many of these individuals come in with a story, with challenges, with medical trauma, with providers, teachers, family members not believing them, not understanding them. And really building a strong relationship has been incredibly beneficial for the clients and then the work that I do. So I spend a long time really honing in on that and building that rapport with my clients before we even work on anything else, skill building or changes that they need to make. And I think just that process alone tends to be pretty validating for clients to experience, and sometimes a corrective emotional experience for them when they've encountered the exact opposite of that in so many other environments in their lives. I think that has been really a key to some of the success of my patients before we even get into a change process. So that's an incredibly valuable and just an essential part of the process to start things off. I think another piece that's been so helpful has been some of the support groups that I've started and hearing everyone's story. The content shifts, it looks different from client to client, but the themes are very similar. And so everyone's story is so powerful. And I felt like I have the privilege of hearing everyone share their stories every day of my life, but how much more powerful it would be for everyone to hear each other's stories and recognize you're not alone. There's so many other people out there going through a very similar experience. And that's really what prompted me to start the support groups as well. And that's also been a very valuable experience that I'm happy to talk more about later as well. But the sense of isolation, the lack of community is really strong for patients who are struggling with POTS and CFS, long COVID, that cluster of symptoms.
Yeah. So, can to validate those who are going through similar struggles, what is often a kind of theme or messages they've had before they've seen somebody like you? What can you give me some of the themes and words and things that have been said?
Yes, absolutely. So I think the biggest theme has been an invalidation among many people in their lives. So, for instance, many clients have encountered doctors who either haven't believed their symptoms or have attributed them all to psychiatric concerns like anxiety. There have been many clients who go through typical testing, scans, echocardiograms, looking at the functioning of their heart when they're describing heart symptoms. And if those tests come back normal, then the next step is just to point them in the direction of a psychiatrist and say, this is all in your head and there's nothing medically wrong right now. And so why don't you start on SSRIs or get on psychiatric medication or go to therapy? And it gets to the point where clients hear this repeatedly over and over again that they actually start to believe the messages that they hear from others and really struggle to validate themselves and believe themselves, have a trust in themselves. I hear often working with adolescents and young adults who are still in an academic environment of a lot of teachers not being able to understand how They can show up to class one day and the next day they're bedridden and home and sick and not able to come to school. And because of the invisible nature of these conditions, there's often a lot of judgment that's passed by others in their life, not understanding the inconsistencies and the up and down nature of the condition and attributing it to clients being lazy or not putting in enough work or not having goals that they want to achieve. But times there's family concerns that come up and parents or grandparents or extended family that don't get it, that don't believe it, that think that clients are just trying to get out of doing something or avoid something that's difficult. And they think that there's a secondary gain in avoiding these things. And that must be the reason for the reported symptoms that they're experiencing.
And often for people who are having these, we call them invisible illnesses as well, where they may have a structurally normal heart, may or may not have a positive heart rate response or blood pressure drop, but they have symptoms of lightheadedness, dizziness with prolonged standing, associated with lots of fatigue, cognitive struggles, associated with a lot of other symptoms that are going on. Often isn't the time to eventually even get diagnosed
Mhm.
is yours. Can you comment on that?
Yeah, I think it's incredibly hard to find physicians like you who are knowledgeable in these conditions to begin with. And so these patients often get passed around to different providers or search for new providers. And I see different statistics. I see 5, 6, 7, 8 years sometimes it takes to get a diagnosis because, like you said, structurally things can look quote unquote normal, but there's still these symptoms that are really unknown what's causing them and often are pointed in the direction of psychiatry rather than pursuing them. So, yeah, I think for many people, it's quite a journey. And over those, 5 to 10 year process of getting a diagnosis, there's a lot of invalidating interactions that occur that really build over time.
And not along with that invalidation is hopelessness because there are very few conditions that you don't get an answer relatively soon and at least have a recognition. If somebody has a terrible diagnosis of cancer, leukemia, it doesn't take 7 years usually to diagnose that. The suffering and the challenges going through treatment is very difficult. Or if somebody has classic rheumatoid arthritis with obvious symptoms or lupus, it's pretty quickly recognized and diagnosed. But when you have seen many doctors, I'm guessing often by the time they've seen you and often by the time they've seen me, there is built into that hopelessness.
Yes, absolutely. I see that all the time and just feeling like there's never going to be an answer. Things are never going to get better. And then start some self blame too. Of this must be my fault or something I did or I caused. Because if all these providers don't have an answer for my symptoms, it must be something with me that's going on. Absolutely. Hopelessness, a lot of self blame, sometimes guilt for different experiences or feelings that they've had all come up in the context of my work with clients.
Yeah. And are there other areas that you've learned or coexisting conditions, so to speak, that you've started to recognize that are more common in people who are struggling with these related illnesses?
Yeah, yeah. Yeah, often there's really clusters of conditions that I tend to see commonly. Certainly on the medical side, we have EDS and MCAS that often coexist with some of these conditions and GI conditions that come up often as well. And on kind of the psychological, psychiatric side, there's often an anxiety present, sometimes pre existing, sometimes in reaction to, and sometimes we're not quite sure the chicken or the egg, but often there's anxiety that kind of runs through these experiences and fears around getting sick or being exposed to other viruses that could worsen their condition. Oftentimes we see depression, which really makes so much sense of, hey, I was living this way for so long. I was engaged in these active activities. I was involved in these sports teams. And then one day my whole life changed. And there's a grief, there's a loss that comes with that. And it's hard to sometimes find the motivation to keep going and to keep redefining what life is going to look like and changing up goals and being flexible in the process. So oftentimes there is a depression that we see coinciding with that. And more, I'm seeing clients on the autism spectrum coming into the office as well. And there's that coexisting relationship with autism and EDS and hypermobility that we see often, and POTS thrown into the mix too. I know there's a lot of research happening out there to figure out some of those connections, but that's something that comes up often as well.
Yeah, and for those who aren't familiar, EDS stands for Ehlers-Danlos syndrome, and MCAS is for mast cell activation syndrome. And these are often can be challenging because when you throw in things like migraines and IBS and the chronic regional pain, painful periods, growing pains, high rates of insomnia that often are coexisting. And sometimes these can be unfortunately seen as unique, separate conditions. But I think holistically, they're all happening in one person, and look at them as one kind of different names for aspects of them. And that also can be more overwhelming when the more labels or diagnoses you have that aren't getting help is just often going to lead to hopelessness. And I've been seeing that too, as I've learned that a lot of people who are more neurodivergent have brains that work differently and react differently to social things, the environment, and other things. And like you say, missing school for those who are in school, having a couple of patients who even for mine recently who are like getting calls from school, one from a truancy officer because missing school and mom having to go and they had the principal had to report. Another principal called me and said, "Hey, is this a medical thing or are they purposely doing this?" And you realize that historically, how many who had been, quote, skipping or truant kids are actually kids who are undiagnosed with one of these invisible illnesses.
Absolutely. Absolutely. Yeah. I see it come up all the time. And it's a struggle. One of the common conversations in my adolescent support group is around accommodations and schools sometimes being very flexible and accommodating and supportive, and sometimes the exact opposite of that, where they're not wanting to support flexibility with attendance or assignments or paring things down or providing that extra support for these clients. And it's a real struggle for these teens who are really doing the best that they can in these circumstances and struggling to see some of the adults and professionals around them not believing them and not wanting to support and accommodate them. And it adds an extra layer of challenge to an already complicated situation.
Yeah. What approaches have you discovered to help those who are living with these invisible illnesses?
Yeah. Like I said earlier, I think the rapport building is my first and foremost approach. And I don't delve into anything else until we have a really solid relationship and until clients are engaged and trusting of me. And once we've reached that point of treatment, then we really start to delve into some more of the approaches and skill building. So I tend to work from more of a skill building perspective. And so cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and acceptance and commitment therapy, also known as ACT, are really three of the modalities that I tend to pull from the most. And I really focus on tailoring the process to the individual. And so it becomes, how do I pick and choose from my toolbox what strategies are going to be most effective for each client, as well as just understanding the nature of a chronic illness and some of the helpful strategies, for instance, around pacing, for coping ahead, putting together a plan of how they're going to manage to go to that party on Saturday that they really want to go to, but are not quite sure if they're going to feel well. Being able to challenge some of the anxiety thoughts that they're having, being able to kind of plan for travel that they have coming up and thinking about pacing and how to go about doing that in a way where they can still enjoy aspects of the vacation but take care of their health at the same time. Getting in there to their thoughts, their belief systems, and being able to work with that to help shift things a little bit when feasible, managing their emotions, helping with communication among family members. So oftentimes we pull in parents or spouses, siblings to the conversation to say, how can you support my clients? What are the things that are helpful? And what are the things that are really harmful or invalidating or actually enabling some of what we're seeing? And so trying to find the right balance of support, yet not accommodating, or sorry, not enabling some behaviors that we want to shift in the process. There is a treatment out there called space. and space is incredibly helpful for parents with children who have anxiety or are just struggling to launch. And I find it really applicable to this population as well. And it's really helping the parents be a cheerleader for their child and support them without kind of getting in the way or doing things for them, but providing helpful support, understanding, and validation. Um, and without kind of inadvertently reinforcing some of the things that we don't want to see. And really, it becomes picking and choosing things that are skills that are relevant for each patient and how to help them live a better quality of life for themselves and to find hope and to find some just opportunities and at the same time shifting what's realistic for them. And that often changes over time. So watching clients be bedridden for a period of time and eventually be able to move across the country and live independently is the process that I love being a part of. And so how do we continue to support you living life consistent with your values and also managing a really challenging chronic illness?
Going from bedridden, and for many of who are not familiar with some of the deep struggles of people with POTS, just doing basic functions for somebody who should be the prime of their life in their teens and 20s, and yet is having basic functioning and hopelessness. I am guessing that, or hearing too, that the locus of control of recognizing in the environment, the social, spiritual, holistic aspect. I think when you mentioned the family who and siblings, etc., how what they're doing can have a positive or negative effect, even though activities would never bother them. It's inconceivable, but is an impact on how they're feeling, how them making a lot of noise is structure changes. I'm guessing, I don't know, that
Mhm.
has to be validating and quite emotional, probably, when somebody who's struggling and a sibling finally connects it. And I'm just imagining, and I guess we can talk more about these online groups, often that isolation to think, I am the only person I know who's going through this.
Yes, yes. And prior to these groups, most of my clients have not met anyone else who has the same or similar conditions as themselves. Every once in a while, they'll be on an online forum, but in real life, have not face to face engaged with someone else who gets it, who really understands it. And so that's been an incredibly valuable and essential part of the process. I had to switch my mindset a little bit because I tend to be more skills oriented in my individual therapy. But for these groups, I will chime in with skills on occasion, but the priority of the group is connection, is engaging, is decreasing isolation, and fostering these relationships among people who are very isolated in their life. And my initial intention was okay, I'm going to do 10 sessions and we'll wrap up after those 10 sessions and everyone will go on and live their lives. And we got to session 9 and started to talk about wrapping up. And everyone in all my groups come to the same conclusion, which is we don't want to end this. This has been incredibly valuable in our lives, and we look forward to coming. And we really cherish these relationships. It's been incredibly helpful. So at this point, my groups are running more indefinitely because the need is there and the benefit was being offered. And my focus really is how do I continue to create this space, bring these clients together, and facilitate these relationships.
How many people are roughly in these?
Yeah, so my groups, they range really from about 6 to about 10 individuals. So I try to keep them pretty small so that everyone can get to know each other a bit. And there's a lot of kind of follow-up session to session of, hey, how did it go when you met that new gastroenterologist last week? Or I know that you were getting that testing done. What did you get the results yet? Or how can we support you with that? I know you're feeling anxious about it. So everyone follows along in each other's lives and each other's story. And so being able to keep the groups more intimate allows for that connection.
Awesome. And For those who want to get connected with yourself,
Yeah.
and you also have other psychologists working with you, can you tell the listeners
Yeah.
about what the opportunities or options they have?
Absolutely. So I'm running Evolvin Therapy and Consulting. It's Evolvin, two N's at the end. And my goal really is to increase access to mental health care for patients across the country who have chronic health conditions. We are able to practice in 42 states, which is really remarkable. And it's all virtual. So being able to open your laptop from bed and accessing a therapist is really our intention and goal. And we specialize in some of these conditions, but we also work with clients with chronic health conditions across the entire spectrum. And, we have providers who are trained in CBT for chronic pain, CBT for insomnia, clinical hypnosis. We work with infertility, postpartum depression and anxiety, GI related issues, neurological issues, cancer, really the whole range of medical conditions. And we are willing and able to meet with clients across the country. And www.evolvin.com is the website. There is a page where you can submit a contact inquiry to get more information and to be able to connect with one of the therapists. And we're more than happy to do a brief complimentary phone consultation or Zoom consultation to make sure it feels like the right fit. And we're able to work with individuals, families, caregivers, and in addition to the pot support groups that are being offered currently. But the hope and intention is to really grow and continue to bring on new providers, starting new groups, and offering new services for clients across the country who have chronic health conditions.
That's where we will finish this week's episode. We will continue the conversation next week. I hope that you've enjoyed this and all the other episodes. If you have, please hit the like and follow button, leave a rating and review. That way, more people who have not yet heard this information that's helpful on their journey can live better. Until next week, go Team Fibro.